So, welcome everybody to Mental Health First Aid England's final webinar of the year, where we're going to be taking a look back on 2024. We're going to be considering where we are now around mental health and also what's coming up in 2025. For those of you who haven't met me before, my name is Sarah McIntosh and I'm the Chief Executive here at Mental Health First Aid England. As with any great webinar, there are a few instructions/helpful tips to help ensure that you get the most out of your webinar experience today. So just to let you know, the webinar is being recorded and you will get a link to the slides that we use in today's session and a recording of the session into your email boxes tomorrow in case you want to refer back to any information or in case you want to share the recording or the slides with any of your colleagues. Cameras and microphones are automatically turned off during the webinar, so please do use the chat facility just to chat to each other throughout the session. Tell us a bit more about who you are, where you are in the country, what you are doing around mental health at the moment, perhaps in your workplace, your organisations or your community, and chat throughout the session. We've got an amazing panel of people today on today's webinar. So if you'd like to submit a question to any of the panel members, you can use the more formal Q&A button at the bottom of your screen to submit a question. And I'll be fielding those throughout the session and we'll have a dedicated session at the end of the webinar to try and answer as many of your questions as possible. If you need to use captions, they are available if you need them. So you'll see you can select a show captions button and you can turn that feature on if you need it. If you need to stop captions, you can select the hide caption button as well. And for those of you who may find the chat distracting, if it is a little bit busy at times, you can also use the hide chat feature as well by clicking on the chat button. So let's take a look at the agenda for today's webinar in a little bit more detail. So in a moment, I'll introduce you to the rest of the panel. We're going to spend some time looking at the key highlights for Mental Health First Aid England in 2024 and also our panellists' highlights as well. We're going to spend some time chatting to an amazing mental health first aider on their thoughts about their mental health first aider role in 2024. And we're going to take a look at where we are right now with workplace mental health and the emerging role of managers and leaders as part of that. And then we'll look forward to what you can expect to see in 2025 around mental health as well. We'll do our best to answer all of your questions towards the end of the webinar, so please do take the opportunity whilst you can to get some views, tips or opinions on the world of workplace mental health and mental health first aid from our expert panel while you've got them for the next hour. So let's introduce you to our panel. You already know me. So Natalie, would you like to tell us a little bit about yourself?
Yeah, sure. Hi, everyone. So my name is Natalie Degg. I'm a mental health first aider, been trained since 2021. Very much a side of desk activity for me, but a most important one. I'm a global internal auditor for Experian by day, if you like.
Brilliant, thank you. And Matt.
Hi there, yeah, I'm Matt Alexander. I work in cybersecurity. I've been around mental health first aid England now for a good 4 years, I think, 5 years. And it's something that's very, very close to my heart.
And also finally, Becky.
Hi everyone. Yeah, my name's Becky Clarke. My pronouns are she, her. I work for a global environmental consultancy and I look after inclusion, diversity and wellbeing for our UK and I region. I'm also a mental health first aider as well.
Brilliant. Thank you. So let's make a start on the webinar then and let's have a look back on 2024. It's been a really significant year for Mental Health First Aid England and there's been lots of hard work, lots of changes and lots of challenges for us as an organisation, as I'm sure for many of you it has been as well. Some key highlights for us. We've trained our 1 millionth learner in March this year, which is fantastic. Just to give you some context, that's the equivalent of everyone who lives in Birmingham. I know we've got a few people from Birmingham who have said hello in the chat. So that's a huge number of people with knowledge and skills around mental health who are making conversations around mental health part of everyday life and helping to remove stigma, which is fantastic. This year alone, our incredible instructors have trained over 80,000 people this year so far. And again, just for context, that's the equivalent of Taylor Swift's sellout crowd at Wembley. So imagine standing in the middle of Wembley and looking around at that volume of people. It's a significant number of people, and we're really, really proud to have achieved that. So a huge thank you to everyone's commitment to helping to improve the mental health of the nation, whether you've been a learner, whether you've been one of our amazing instructors delivering our courses, or whether you've been a workplace or organisation that's created training opportunities for your people. Another huge highlight for us was our My Whole Self Day in 2024. So some of you will know this is our campaign to create more inclusive workplace cultures. We've celebrated 5 years of our campaign this year, and we had over 200 organisations taking part in the campaign, raising awareness of inclusive workplace cultures, but also utilising our free resources and tools. We also launched a new podcast called Off the Top of Your Head, and we launched it in Mental Health Awareness Week, and we had some fantastic guests talking about and sharing their experiences and wisdom around mental health. And we've had almost 5,000 downloads of that. You can check out that podcast on Spotify. You can go to our website and have a look. The episodes are available for you to listen to, but I definitely recommend. They're really, really great. We've also done a lot of influencing this year. So we've worked with the top 10 mental health organisations in the UK to collaborate together and help to shape and advise on the draft of the new mental health bill, which is currently working its way through Parliament to become new law in 2025. And we've also worked closely with the Department for Health and Social Care this year on the new NHS 10-year plan consultation. So we hosted a few events last month with mental health first aiders, with our instructors, and with workplaces to hear and represent your views in our response to the consultation as well. We were also recognised as one of the UK's best workplaces in education and training, and a UK best workplace in the charity and not-for-profit sector. And we're really proud of that. So hopefully that shows that we are walking the talk ourselves when it comes to creating great places to work and places that support mental health and wellbeing. And our biggest achievement of 2024, and my own personal highlight, was the launch of the Association of Mental Health First Aiders back in June. This is England's first and only membership body for mental health first aiders, and the impact it has created so far has been phenomenal. So we now have over 39,500 mental health first aiders who've joined membership of the association, and this now makes us one of the top 100 membership bodies in the UK. It's such a crucial milestone for us here because if you think about it, mental health first aid training shouldn't stop with just a single course. It should be an ongoing journey of learning, experiences and understanding. And by creating the largest dedicated community of mental health first aiders as a membership body, we're really helping to support mental health first aiders long after their course to really make a difference with their knowledge and skills. As part of the launch of the association, we did some research and we found out some phenomenal impact statistics around mental health first aiders as well. So our research showed through the association that over half of mental health first aiders are having supportive conversations with people at least twice a week. So that means that mental health first aiders are having around 10 million life-changing and life-saving conversations every year. And for me, that's what I call impact. So a huge thank you if you've joined the association already. If you haven't joined the association yet, join now and grow our huge community of people that are dedicated to supporting mental health. You can check out our website for more information of how to join. And I know that Ellie in the team is going to drop some information in the chat now as well if you want to find out more about the association or how to become a member. So that's some of MHFA England's highlights from 2024. We'd love it if you would also pop your top mental health highlight or achievement in the chat too. It might be a personal highlight, it might be something that your organisation has achieved, or it might be something that's happening in the wider world of mental health. But whatever it is, we'd love to hear about it. So take some time to pop into the chat now. And whilst you're doing that, I'm going to check in with our panellists and hear from them about their highlights around mental health for 2024 too. So I'm going to come to Matt, you first. Tell us, what was your top mental health highlight or achievement from 2024?
Well, I think it's quite an easy one, this for me. I work in an industry that it can be difficult at times, cybersecurity, information security, and I think I've always struggled a lot with in my previous career, which was professional football. I've always struggled around being in and around that industry and not feeling like I'm actually supposed to be there. So when I moved into the cybersecurity industry about maybe 4 or 5 years ago now, it was a watershed moment for me, really. And this year, I've moved into a new company. I have moved, I would say, a little bit to the next level of my industry. I work for a big company, AXA, as you know, and they're really supportive around my mental health and how I can be the best version of me at work. So I think this year my mental health achievement or highlight would be making that move, and just feeling like I can really contribute with not just my educational background, but also my experience. I think people being able to see I'm not the youngest in the industry, to be fair, but my experience is just as valued as my education. So yeah, that would definitely be my highlight, making the move to a bigger company, a bigger position, and feeling like I can actually bring myself to it.
Brilliant. What a great personal highlight, and great to hear that AXA are supporting you really well with that as well.
Yeah.
Thank you, Matt. Natalie, I'm going to come to you and ask you about your highlight.
Sure. So a highlight for me, I think, was completing my refresher training earlier this year and getting access to the new Mental Health First Aider England app. You don't realise how valuable the information is until you need it. So, for me, in the moment when you're right there and you need, maybe just to check on, oh, what was that thing that we needed to do again? Or how can I help this person? It's on your phone. It's ready to go. And, more specifically, the Hub of Hope has just been invaluable. And I've actually started to use it as a tool, working with people. So as I'm supporting them, I'm sitting them down, I'm going through the Hub of Hope with them together, and we're looking at options of support. And I think it really encourages the person in the moment because they can see that there's support available. So, in that moment when they might feel helpless or they're spiraling or they may be in crisis and they think there's nothing, for me, getting that app out and saying, look, these are the services that are available, we can get you help now, has just been, as I say, invaluable. It's been brilliant. And I think having that on hand for all mental health first aiders is just going to be, life-saving, for sure.
Brilliant. Thank you, Natalie. For those of you who are not familiar with Hub of Hope, if you're a mental health first aider, you can access Hub of Hope through the Mental Health First Aider app, but it is a signposting tool. So it shows you all of the national level or local level organisations that can help with different aspects of mental health, and also the local services for mental health as well. So it's useful in a conversation if you're supporting somebody's mental health to perhaps get that out and have a look at it and signpost people to somewhere that can help and support them. Thank you, Natalie. Finally, Becky.
Yeah, thank you. I'm going to talk a little bit about some of the work we've done at Sentec around our mental health first aider network. So this time last year, we hit over 120 mental health first aiders across the UK and Ireland. And I sent a questionnaire out to all of them about how we could more effectively support all of them as a network. So, and they came back with some great information and advice, and we took all of that on board. So we've got a really great Teams network where they can all talk to each other. But what they were all really interested in was actually having some training across the year, as well as their ongoing mental health first aid refresher training. So we put that in place, and we've had quarterly sessions this year. The reason this is a highlight is because the first session we went about running was about disclosure. I think that's something that as mental health first aiders we all really struggle with. When is it appropriate to disclose a particular situation? And so I ran a great session with our UK HR director about when a mental health first aider should disclose to HR, and obviously when there's a risk to life. A few weeks after that session, one of our mental health first aiders was faced with exactly that situation and needed to disclose to HR, but she knew exactly what to do. HR knew exactly what to do. And actually, I think we potentially saved a life that day. And I think for me, that as tragic and awful a situation as that was, I think I'm just incredibly proud of the network and what we've created and how that's really working for us here at Sentec.
That's brilliant. Thank you for sharing that, Becky. So an example of how at an organisational level you've created the right environment for people. You've created the training, but you've also put things in place to help them on the ground to make a real impact and a real difference to supporting someone in the moment as well. And again, that life-saving preventative nature of the roles as well of a mental health first aider. Thank you so much. I've just been looking down the chat at all of our attendees' amazing mental health highlights, which again range from personal highlights around your own individual mental health and what you've achieved. They range through to having supportive conversations with people around their mental health and supporting other people, right through to getting roles around mental health or having organisational strategies, policies, processes, and putting things in place to really make a difference in your workplace or community organisations. So thank you for sharing those. Lots of amazing, fantastic impact this year. We're going to move on a little bit now and focus on how 2024 has gone for mental health first aiders themselves. So we're going to hear a little bit more from our panellist, Natalie, to get some thoughts from a mental health first aider perspective. So Natalie, tell us a little bit about your journey and how you've been utilising your role, knowledge and skills as a mental health first aider this year.
Yeah, sure. So, as I mentioned, I was first trained in 2021, and that was kind of in the midst of the pandemic. And we were just as an organisation trying to get ourselves together about what support we could offer. So there's a relatively small group of us trained. And I think everything felt very new at the beginning. I think everyone was a little bit cautious, a bit scared. No one knew how to approach us. We didn't know how to approach them. But actually, as time has gone on, and definitely kind of fast forward into this year, the difference in the openness and the shift in culture of people being a lot more comfortable with talking to mental health first aiders. And we've got a database in our organisation where people can just go on and find us. We can search by name, region. We can search by topic areas if we've actually have lived experience of some sort of topic. So it's really, it's been a bit of a journey of kind of starting out, not knowing how this would go. Would people be willing to talk to us, to actually seeing it in full utilisation and really seeing the benefit of us being in place. It's been really great.
Brilliant. Thank you, Natalie. A couple of questions for you, if that's okay, about your role and how things have gone this year. But how do you think becoming a mental health first aider has changed your understanding and your understanding of your own mental health, I guess, as well?
Sure. So I think becoming a mental health first aider has given me a bigger perspective and an ability to understand and empathise with what people might be going through. I think some of us, when we think about mental health, our mind goes straight to suicide, depression, anxiety, the big topics, the big hitters. But actually becoming a mental health first aider has helped me see that there's so much more that somebody could be going through. There's so much more going on in a person's life, and there's so many different ways that a person can be supported. And I think the training significantly enhances it enhanced my understanding of mental health. Gave me a greater awareness of the complexity that is mental ill health, but it also gave me those kind of tangible tools to recognize early warning signs and enable me to be proactive in my approach. Tools like the app, as I've mentioned, in terms of being able to direct that support, get a person the help that they need. And I think it also, being a mental health first aider, it also transforms how you interact with others. So I've been able to utilise the training to develop and build on the active listening, the non-judgmental communication, being more empathetic, as I've said, using the algae method. That is, I've spoken about this a lot, but that is ingrained on my brain for good reason. And it's almost like it's there at the back whenever I start speaking to somebody, it kicks in straight away. And I think that is one thing that anybody can take away from being a mental health first aider, is that, because it really does equip you to provide that kind of practical and emotional support where you need to. And I touched on it a moment ago, but there's I've seen a real shift in the culture within organisations, but also within the mental health first aider community. I think everybody's just got this care and openness, and I think that in turn makes mental health discussions more accessible for everybody. And I think lastly, on a personal level, as you mentioned, it's reshaped my own attitude towards mental health. So I'm sort of a person that will run 100 miles an hour until I've got nothing left in the tank. And I think since becoming a mental health first aider and talking to people that are obviously, maybe experiencing that, I practice more self-reflection now, and I see mental well-being being essential for me. I need to take time out. I need to step back. Maybe I need to get some support. So I try to role model that for, the people that are around me, prioritizing my own mental health day to day, so they can see that I'm doing that, in hope that it inspires them to do the same, essentially.
Brilliant. Some very wise words on role modelling, mental health and wellbeing, self-care there as well. If you think about the role of a mental health first aider, what role do you think that they play in making mental health an everyday conversation?
So I think that's such an important role, and I don't take that lightly, being in that position. I'm so proud to be a mental health first aider and be part of that community. But I think the role is about changing how mental health is viewed and talked about. So I spoke about before, back in 2021, people were a bit approached with caution. We don't know what these people want us to talk about. We don't know how much we want to open up. But actually, through that campaigning and through being visible and talking to people, we've really helped break the stigma and normalize conversations. And I think that as that continues, that can only encourage people to speak up earlier and earlier and get them help, as soon as possible, really. I think, some people still see mental health as a scary topic. And, I've heard people say, oh, you only talk about that with a professional, I'd only speak to a doctor about that. But then their opinion switches when they actually see mental health first aiders in the organisation around, when they've seen someone receive the support, and they've gone, oh, that's a person that I work with, or that's one of my friends, that's a family member. It normalises that we're just humans, we're just people. But actually, we've been trained and got a set of skills that can actually help, and in some cases, like Becky said, save lives in those certain scenarios. So I think, mental health first aiders play a huge role in kind of just creating that whole environment where mental health is valued, it's open, and it's prioritised. And I've said this before in terms of me banging the drum, because that's what I do, continuing to bang the drum to promote that openness, that empathy, and making sure that mental health in whatever aspect is just part of everyday life, just like the physical stuff. We hear the analogy sometimes of, if you've got a broken leg, everyone rushes, and oh, you've got a plaster cast, and great. Mental health needs to be as simple a conversation as that. It should be as approachable as that. And I think that's the role that mental health first aiders play in this, is making people feel more comfortable discussing whatever aspect of their wellbeing they need, and helping them take proactive steps to care for themselves and others.
Great, thank you for sharing your experiences. So that's really great to hear. Let's take a look at where we're at with the workplace mental health right now. So Natalie, you've talked a lot about being a mental health first aider, perhaps in a workplace setting, but also perhaps when you go home, and that ripple effect in your local community. But how are organisations and employers dealing with mental health right now? So the UK workplace has been impacted so significantly over the last few years. We've been trying to navigate all sorts of things, from remote hybrid working, the cost of living crisis and the impact of that on our staff. We've had a new Labour government with a new budget that's placed particular demands on business as well. We've seen increased sick leave due to stress, poor mental health. It's been really quite tough for workplaces to navigate the best way to support their staff and their employees, and to put the right support in place. There have been some great developments emerging in workplace mental health, but there's still a huge long way to go. Here are some of the latest statistics from 2024 around mental health, just to give you a sense of where we're at right now, I guess, with workplace mental health. So we can see there from the Global Business Collaboration, over half of UK workers are reported experiencing or having experienced mental health issues in 2024. 35% of employees feel that there is still stigma around mental health in their workplace. Long-term absences due to mental ill health have increased significantly to 63%. And the cost of poor employee mental health has increased again significantly to £51 billion per year, from 45 billion. So that's the cost to the UK economy of poor employee mental health. And 1 in 5 workers in the UK have needed to take time off in the past year due to poor mental health caused by pressure or stress as well. So we've still got some huge challenges in workplace mental health, even though we've made some great significant strides and improvements. So let's just go over to Becky and Matt now on our panel and look at things from a workplace perspective. Key question for you both. What do you think are the current challenges that workplaces are facing when they're trying to create mentally healthy workplaces? So I'm going to go to Becky first, if that's okay, and then come to you, Matt.
Thanks, Sarah. Yeah, really great question. And like you say, I think we've made great strides in the wellbeing space. You know, I think we've done a huge amount of work around raising awareness with, you know, awareness campaigns and things like Time to Talk Day, World Mental Health Day, and so on, and what we've done in that space. We've also made great strides in terms of mental health first aid, you know, provision of EAPs and support networks for our employees. I think for me, one area that we really need to concentrate on is the impact of the workplace on an employee, and how employers can create healthy workplaces where employees can thrive and are engaged and productive. And I think that brings with it lots of different things. So employers understanding workload pressures, the risks around psychosocial health and so on, and really understanding the impact of what it means for employees who have too much work to do, who don't really understand what their role is, who and manage, you know, going through times of change. I think there's a piece of work that needs to be done about just how we create those psychologically safe environments where employees are okay to ask for help, and feel that they'll be listened to. And I suppose the third point then is then enabling our line managers and our people leaders to know how to support and create that environment, and have the tools at hand that can really create that very supportive environment, and manage and lead in a very compassionate and an empathetic way. I think they're my key points. Sarah, you're on mute.
I knew someone was going to say it at some point during the webinar to me. Thank you for that, Becky. That was really helpful. And now, Matt, your kind of view on this as well.
I was going to say basically exactly what Rebecca said.
Brilliant.
I think it's really difficult for workplaces because it's always a changing environment. It's been really difficult the last four years since the pandemic, and I think my thing that sticks out really is the work from home aspect to it. We're obviously seeing people coming back, and companies now wanting people to get back into the office as quickly as possible in different ways, whether it's a hybrid role or all these different things. And I think doing that needs a little more thought. You know, people have been working from home, being able to work around their family commitments, things like that, and just saying, right, now everybody's back in the office tomorrow, it's really going to cause quite a few problems. And I think from my own personal point of view, you know, I work in an industry where working from home has been pretty the norm for quite a while. And, you know, you work in quite an isolating role where you do have the support from your friends and your colleagues and stuff, but it's very different being at the end of a computer in your room, in your office for, you know, days on end. So I think there needs to be some care and some real thought around coming back into the workplace, how that's going to work for the individuals. And I think rather than just saying, yes, this is what's happening and this is what's happening now, I think people need the leaders need to make sure that the workforce is mentally prepared for coming back into the workplace.
Yeah, lots of challenges there, Matt, in that whole agenda. It's quite interesting as well. I've read some research recently that talks about remote working envy. So all of the industries that don't have the opportunity to work from home and are longing perhaps for that to be a better work-life balance for them, and how, you know, thinking about how they might switch careers and whether they could do those types of roles and all sorts of stuff as well. So I imagine there's all sorts of other interesting stresses in those types of environments as well, because they're not able to do that.
Yeah.
Thank you for that. That's really helpful. In 2024, whilst we all know this very, very well, what we did see was the role of leadership emerge as a crucial area of the workplace mental health jigsaw. We know that managers play an instrumental role in creating psychologically safe workplaces and healthy workplaces for employees and teams. But there were some great statistics that came out in 2024, and my personal favourite statistic from 2024 was from the Workforce Institute. So that top statistic there, so managers have just as much of an impact on people's mental health as their spouse, and even more of an impact than their doctor or their therapist. I mean, just let that sink in for a moment. That's a huge amount of influence and impact that one person who is doing a job in a workplace or an employment environment is having on individuals. I found that quite fascinating, and I think it really resonated with me in terms of creating mentally healthy cultures and how significant that role can play in the creation of those. However, even though we know that, there was also research from the Global Business Collaboration that shows us that organisations are still underinvesting in managers' skills around mental health. So less than half of managers have had any kind of training on how to have a mental health conversation and how to support someone. And even when they are having conversations, people are saying that half of people are saying that those conversations were a one-off and not necessarily a regular conversation around their mental health and well-being. So again, just going back to Becky and Matt with your kind of workplace hats on, what do you think is the best thing that managers or leaders can do to help support employees that work with their mental health and well-being?
Shall I go with this one, Becky? Or
Yeah, that'd
Yeah,
be
you go.
great. Thanks, Matt.
Then you can say ditto. I think it's a real responsibility that the managers have, and obviously, people will look on the outside and, well, you get paid to do this and blah 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 blah. But I think it runs deeper than that. I think a manager can't be your friend all the time. It's a work thing, so they can't be there all the time. They have their own things to deal with, their own problems, all of this sort of stuff. But I do believe that specific training is needed, not just the usual generic training around maybe mental health first aid and things like this, but specific managerial training in how to deal with, your employees, the staff that work underneath you, all of that sort of stuff. Because not only that, as I said at the beginning, it is a huge responsibility. You are taking on people and their problems and their issues, as well as being able to manage your own daily stuff and your own problems and issues as well. So I think the best thing managers can do, and not only managers can do it, but I think employers can maybe enforce this onto their managers a little bit, is to get that specific training around how it's going to work and how you deal with individuals.
Yeah,
if I could just add to that, Sarah, if that's okay.
Yeah, of course.
I don't know if anyone's heard the term like accidental manager. That seems to be quite a popular term that we talk about this year. And I think that's one of the biggest problems that attributes to this is, people get put into management positions. And I was one of those people earlier in my career that you do a great job at this, so we're going to promote you into management. And doing a great job at something doesn't qualify you to be a manager of something. And to Matt's point, there needs to be specific training about, you are now taking care of human beings. They are looking to you for some sort of support, and I think that is a huge hole that we have, and I don't have the answers. I don't know how to fix it. I don't necessarily think mental health first aiders will fix that hole, but yeah, I couldn't agree more in terms of the gap that we've got in terms of managers and the importance that they play in an employee's mental health in this space. Sorry, I just wanted to add that.
Just to add to that as well, just to add to that, I was exactly that in my previous role. I was an accidental manager. I was 33 years old and chief executive of a football club. It's really difficult to manage everything. And that is probably the point where my mental health suffered the most. So having to deal with other people's and understand other people's, it's really daunting. So I think, yeah, just to add, I think that specific training is something that is really, really needed.
Thanks, Matt. Thanks, Natalie. Becky, what would you add?
Yeah, it's kind of hard to add to all of that. I think what they've said is absolutely right. There was a massive gap where our line managers do need some training or some tools. I think about maybe having that conversation, how to have that conversation. I often hear in my role, both as a mental health first aider, but in the job that I do, that line managers are kind of quite scared, quite wary about having conversations with their their team members about their mental health, but also around neurodiversity, around having a disability, all of different, sort of aspects of looking after and caring compassionately for a team. And so maybe it's creating just some really simple conversation tools. And I think the biggest power is for them to understand what their role is in that, and that when there is no expectation for them to diagnose, to solve, to completely sort these issues out, but that they can listen, and they can be compassionate and empathetic, and then know where to signpost to, and understand all those signposts that their company offers, or external signposts. I think maybe there's something in that, just some really simple conversation tools that just break it down to listening and signposting.
Brilliant. I think you've hit a crucial part of things as well there, is in addition to the training, it can be really hard for managers to understand, where the support is on offer and what's on offer within a workplace setting, and the policies and the processes that go on behind the scenes that are designed to help people. But unless you know about them, know where they are, know how they all link together with different support services, and be able to articulate that to your team, which is a big task in and of itself. All of that can be quite invisible to managers and to staff as well. So you can definitely empathise with that, and what you've just said there, Becky, as well. Okay, we're going to move on a little bit now. So we've spent a lot of time looking back at 2024 and having a little look at where we are right now with mental health, first aid, and workplace mental health. But let's have a look at what we can expect to see in 2025 that will influence mental health, both in the workplace but also beyond the workplace as well. So there are two pieces, fundamental pieces of legislation heading our way in 2025 that you will no doubt have heard about in the media in particular. So firstly, we've got the Employment Rights Bill. So this was introduced to the House of Commons on the 10th of October, which was also World Mental Health Day. And it's been described as the biggest upgrade to employee rights at work for a generation. So the government says that the bill will help to drive growth in the economy and support more people into work. But some of the things that the bill will address will be things like one-sided flexibility, so that there is a baseline of security for employees, supporting family-friendly rights by improving flexibility and security, prioritising fairness, equality and well-being. It will have a focus on fair pay for a fair day's work. It's looking to modernise trade union legislation and give trade unions greater freedom to organise within a workplace setting. It will improve the enforcement of employment rights, and it will also look to establish a Fair Work agency to enforce some of the regulation that will come into place as part of the bill as well. And we know that all of those things can contribute to either positive or poor mental health in employees as well. So it will have a huge impact in terms of employee mental health and well-being in a workplace setting. The second big piece of legislation that will influence mental health across the UK is the introduction of the Mental Health Bill. So some of you will know the Mental Health Act itself has been in place for some time. It's needed reform, some radical reform, because it hasn't quite been working. It hasn't been improving things for those who are experiencing mental ill health at all. So the introduction of a new version of the Mental Health Bill it's long overdue, to be honest, but it's designed to create a mental health system that better meets the needs of today's society. So we all know that 1 in 4 of us will experience a mental health problem every year. We've also probably heard that there are over 2 million people currently on waiting lists for mental health care as well. And so it's really critical that mental health receives the same level of attention, funding and prioritisation as physical health. So some of the changes in the Mental Health Act will include things like introducing statutory care and treatment plans for people. It will give people a greater say in their care, but it also limits inappropriate detention of people with autism and learning disabilities, which has been a long-standing challenge of the existing Mental Health Act as well. So all of those things give a significant improvement in safeguarding people's dignity and choice. The key thing with the Act, it will only be successful if robust funding and more resources are made available to support its implementation. And that needs to help address the backlog of patients that are waiting for care. It needs to help fund mental health crisis hubs, and it needs to ensure that there's 24/7 access to emergency mental health support, and enough of that support as well, so that people are not stuck in the system waiting for urgent care. So the Mental Health Act is going to be crucial to workplaces where they're supporting employees with diagnosed mental ill health conditions, but also to mental health first aiders who many of whom face challenges when they're signposting people to different mental health services, knowing that there are huge waiting lists and delays in some of those services for treatment and support as well. So designed to have a positive impact for workplaces, but also for mental health first aiders when they're signposting. Other things that could appear in 2025, so they're not definite, but they're emerging conversations and proposals. So firstly, the right to switch off. You may have heard about this already. This has been in place in France for quite some time now as legislation, but the idea is that the new Labour government have proposed to introduce legislation about the right to switch off. So it gives workers a right to disconnect from work outside of working hours. So no emails, no phone calls, no expectation to do any work outside of work hours, unless there's a previous agreement or an on-call type arrangement with an employee. So the aim of that is to have a positive impact on things like employee burnout and stress at work as well. So that's been proposed. They're still working on some of the detail of that, but that's likely to be spoken about more in Parliament over the next few months. You'll also see an increasing dialogue around the role of workplaces in suicide prevention. So one of our predictions is that you're likely to see workplace standards and possible regulation emerge as a result of those discussions. So in a workplace setting, managers in particular, or team members in particular, get to see people on a more regular basis sometimes than their family members do. So, spotting signs and symptoms, making sure that if something's disclosed, that some support is put in place for an individual to prevent suicide behaviour or a suicide itself is going to be key. So some kind of regulation coming into that space is likely to happen. Everyone's talking about AI. Every conversation I have, at some point, someone will raise artificial intelligence or ChatGPT, for example. So there's a huge focus at the moment in the UK to create a framework for AI regulation and how we develop AI and how we use it ethically and in a way that creates positive impacts and not negative impacts. So there's all sorts of opportunities in that with AI to help people's mental health, but there are also a heck of a lot of risks around people's safety, the robustness of AI tools, and also the potential impacts on people's mental health, where people might be worrying about things like job security and whether AI is going to take some of the roles that they currently do as well. So that's definitely an emerging conversation that will continue throughout 2025, and mental health will be a big part of that conversation. And then finally, the government is committed to tackling discrimination and structural injustices around race and disability. So there is a proposal for a new equality, race and disability bill. They're still working on the specific terms of the bills, but it will include measures around things like equal pay, mandatory pay gap reporting, and strengthening protections around dual discrimination and inequality as well. So again, all of those looking to tackle discrimination, harassment, bullying, supporting, the bringing of my whole self to work as we campaign for every year as well. So they're things to watch out for. At Mental Health First Aid England, there's a few things that you can expect to see in 2025. So we'll be running our My Whole Self campaign again. The date there is the 11th of March, so pencil that into your diaries, and there'll be more information coming out about the campaign in January to help you to prepare to join us as part of that campaign, to raise awareness, to adopt some of the resources and tools that will be coming your way as part of the day itself. So get ready for that. Ellie's going to post some information in the chat for you, so you can check out that information a little bit more and get some plans in place to join us. In addition to that, what else have we got coming up? Well, we are launching our new Youth Mental Health First Aid course. So we've had a Youth Mental Health First Aid course for some time, but we've done a radical overhaul of it and updated it. We've co-designed the course with young people, which has been great. So we've had a team of young people working with us to advise us on the content, to advise us on some of the scenarios and the case studies and how best to support them with supportive conversations around their mental health. And that's launching on the 14th of January. We're also launching a new youth mental health first aid refresher course as well, early next year as well, so that people can continue to refresh their skills around youth mental health on a regular basis. And we'll also be launching a new people managers course as well. So this is designed to help people managers to explore how to create mentally healthy and productive workplaces. So the more proactive end of things rather than the kind of supportive mental health conversations that we've also discussed today. We'll share more information about that new course in early 2025 as well. So we've gone through quite a lot of information and we've heard quite a bit from our panel members as well, but we're now at a point where we can go to the questions that have been posed in the Q&A function. So there's a few questions that have come through already, which is great, and I'll start with those. But for anybody else who'd like to post a question to get some advice, tips, wisdom from our expert panel members whilst they are with us for the last 15 minutes of the session, please post your questions now. So let's have a little look what we have got. There's quite a few. Okay, here's a question for you. So if we obviously know that one of the stats that we saw before was that stigma can still exist within workplaces or within organisations. Does anyone have any sort of tips or suggestions around ways in which we can reduce stigma in workplaces? Is there anything that you've done already that's worked well, or anything else that you could suggest that might contribute to reducing that level of stigma? Natalie, you came off mute like you were ready to answer that question. We'll go to you first.
I came off mute and then I was like, oh, I just linking back to what I said earlier, I think if you have mental health first aiders in the organisation or people that are passionate about this, getting them out in front of people, getting them visible. If there's a shared space, I know most of us work remotely, but if there are people in offices and getting a shared space, pop up a stall, a little round table with, open door with, and just get people familiar with the normality of, we're just here to talk about this and this is a completely normal conversation. And it's worked well for us in the past. We've had things like fairs in our canteens where we just rock up and we're there and we are your mental health first aiders, come and chat to us, and it just helps break down that barrier of that we're some special people that shall not be named and shall not be talked to. So be visible, and however you can get your people in front of your population, do that. All hands webinars such as these, just to kind of normalize who they are and then how they can help. That would be my advice.
Great, thank you. Becky, Matt, anything that you want to add to that?
Yeah, actually, I wrote some notes down whilst Natalie was talking the first time around having mental health discussions, and there's been a bit of a shift in that it feels a little bit easier to do that sometimes. And I wrote down care, because I think we can sometimes overthink this, and I'm as guilty of it as anybody when it comes to overthinking, but just showing a little bit of care. I think we live in a society these days where everything is, as we are now, is digital. We don't spend a lot of time in front of people, and I'm wondering if there's a level of just that level of care that's disappearing a little bit, and that's the worrying thing for me. So to make things easier for people to come and talk to you, to have that conversation, like Natalie says, be visible, but just show a little bit of care and compassion for another human being. I think that's the main thing. Allow yourself to talk, allow yourself to be open. I've always been, I wouldn't say I've always been like that. I think it's come in the last few years, really. But I'm really trying just to open myself up to other people and allow them to see that that level of I'm not a superhero. I'm not, perfect in any way, and neither is anybody. So sit down, listen, and just care for another human. That's the that's the thing that I would go with.
I love that, Matt. Thank you. Becky, anything that you would add?
Yeah, I was just gonna reiterate what Natalie's already said about it's kind of normalizing that conversation a bit, isn't it? It's making it okay to talk about, using the words that people kind of sometimes choke over a little bit, and just so some of the things we've done some storytelling. So we've had some of our senior leaders talk about some of their mental health issues, and we created videos of that and shared them, which was just incredible. For things like World Mental Health Day, we've done tea and talks where our wellbeing champions have a bit like you, Natalie, set up stalls with information and got people just having a cup of tea and a biscuit, and whether they talk about their mental health or not, it doesn't really matter, but the fact that they've come together. And the other thing we do at the start of a lot of our meetings is we do meeting moments, which came really from health and safety, but we now have made them health, safety and wellbeing moments. And so we've created moments that can be about mental health as well. So just again, bringing it into that sort of everyday sort of business as usual stuff and getting it talked about. I think that helps break down those sort of stigmas.
One of the other things I've mentioned, if you've got a global team, and I mentioned obviously that we've got remotes and global, so it's not always possible to get in front of people's faces. Something that I found works quite well is utilizing like Microsoft Teams or Slack or Zoom and creating a specific channel and kind of welcoming that just free flow of conversation, sharing resources, information, and just becomes like a chat. And then I think some people feel more comfortable that it's kind of behind a keyboard and they can open up, and then that starts different conversation. But that is another way you can start to normalize those conversations. But if you've got global teams or different people in locations.
Yeah, thank you. There's loads of great suggestions in the chat. I'll just give you a couple. So Ray says that they also do mental health moments on a weekly basis in an email that focuses on a different topic each week. So it might be bereavement, dealing with difficult family members. That's an interesting topic there again, but a good, a huge source of stress for some people at times as well. So we've also got Paul, who says they've got wellbeing rooms in some of their larger offices with a dedicated phone line that people can use and a notice board with signposting information for people. It's a really great quiet place for someone to go if they need it. Natasha talks about having blogs on the intranet of perhaps colleagues who are willing to open up and share about their personal stories around their own mental health as well. And perhaps where that's not possible, there was another great suggestion from Heather, who said that she recently went into a school and saw a wall of pictures of celebrities that highlighted their neurodiversity, but also their mental health conditions as well, so that it makes those diagnoses more relatable and more mainstream for people and starts conversations as well. So those are great suggestions in the chat as well, so thank you for sharing those. That's brilliant. There's a question in the chat for Becky, actually. So there's a question that says, what other training do you provide for your internal network at Sentec?
Yeah. So the first one we did was the disclosure one, which I talked about. Actually, the second one we did was a reflection on that, because it was following the incident that I also talked about, which was just a really great session, just to just reinforce what we've done. We've done a session around neurodiversity where we have a neurodiversity employee resource group. So our ERG chair came and spoke to the mental health first aiders and talked about that sort of intersectionality between mental health and neurodiversity. And then we had a great session from Every Mind around setting boundaries for our mental health first aiders. So yeah, for us to set our own boundaries about when we have conversations.
Wow. Matt, Natalie, are there any other kind of training that happens in your organisations that you're aware of that helps with this kind of mental health conversation as well?
I mean, sorry, Natalie, go ahead.
It's okay. Heavily utilised, obviously, our mental health first aider population, but we also have an employee resource group. So we bring that out and we put that in front of, as I say, as many employees as we can. So we call it the Every Mind network, and it focuses on all aspects of your well-being, whether that be physical, financial, mental health. So it's how all of that can impact an employee's mental health. So we it's not training per se, but it's something a tool that we can use to inform and provide that signposting to employees.
Yeah.
Great. Matt?
Well, I've not been at my organisation for long, so it's still getting my feet under the table, to be honest. But one thing I've noticed is that there is a definite culture of wanting you to succeed and wanting you to help you do that. And I think one thing I've noticed as well is we have Mind Allies, which are, I think, MHFA trained people with a little bit of extra training on top of that. That's something that I'm actually going to be looking into a little bit more in the next year. But yeah, the overall culture of the company I work for is I can only say it's been really positive to start, and that's something that makes just working even easier, you know. So yeah.
Brilliant. And we've got a final question, I would say. So we've talked a little bit about people managers, so I guess managers of teams and the influential role that they can play in creating mentally healthy teams and cultures, I guess. But there's a specific question here about really senior leaders. So those that are kind of, you know, the big bosses, the senior leaders in the organisation. Are there any examples of great things that you've seen senior leaders do in your own organisations, or that you'd like to see them do as well, I guess? If I perhaps come to Becky and then Matt and then Natalie.
Well, I think I've probably mentioned a couple already. So we had some of our senior leaders tell their own stories, their own mental health experience stories, which was amazing. We asked them to do some of these meeting moments. So when they're doing their big sort of all company meetings or regional meetings, you know, we can sort of say, could you do this at the start and mention that? And we also, you know, we can get our office leads communicating as well about mental health and wellbeing in their sort of briefing sessions as well. So having said that, we're kind of feeding that information to them and asking them to do it, but they do pick it up and they do it. But I think the biggest impact was the kind of mental health videos that they created and stories that they told.
Brilliant. Thank you.
Yeah, we have virtual meetups once a month with one of the senior leaders in my group. He just checks in. We have a specific date and time, and we have half an hour catch up just to see how things are going. How am I ingraining myself into the company? How are my thoughts? All of this sort of stuff. And we also have every 2 weeks is a kind of virtual drink up. You know, you can sit online with the leaders and we talk about everything but work. So it's how's your week gone? Obviously work sneaks in there every now and again, but you know, from my point of view, I use that as a time just to get to know the more senior guys, and there's probably 2 or 3 that come on those calls every 2 weeks. So yeah, it's been really helpful from my point of view. And I think just to see them not in that senior role and they're just sat at the end of a computer having a drink and having a chat, I think that helps everybody, to be fair.
Brilliant. Thank you, Matt. And Natalie?
So we've got one of our senior executive leaders as a sponsor of mental health, so both regionally and at a global level. So we've got a UK sponsor and a global sponsor. And I think just by having that and having them, similar to what Becky said, share their stories, why they're interested, why they're advocating for this, really helps kind of the lower level or the ground level workforce get an element of buy-in. The visibility piece is always there, so we encourage our executive leadership team to come in when we celebrate and mark things like World Mental Health Day, suicide prevention. Whenever we're doing any of those large campaigns, we draw upon our executive team to kind of say, you know, what's your take on this? How can you be visible in this space and share your views? And more recently, I actually had the opportunity to go in front of our board of directors and encourage them to be trained as mental health first aiders, so that they could not only support themselves, but support obviously the rest of the workforce. So that was quite a significant milestone, I think, in explaining the importance of the training, how it's helping the workforce, how it's helping the community, and why they should get on board. And it went down really well. So I think getting them bought in and trained is a massive step.
Great. Thank you, Natalie. We are at time. It is 12 o'clock, so we'll bring the webinar to a close. Thank you so much to our expert panel for showing their insights and their wisdom around mental health. That's been super useful. And thanks to everyone that's attended today. As I say, you'll get a copy of the slides and also the recording of the session in your email boxes tomorrow. So feel free to refer back to them or pass them on and share them to other people you think may find this session useful. We haven't been able to get through all of your questions, but what we will do is go through all of them. And when we send out the information to you, we'll try and address a couple more of them as well in the written information that we send out to you. But again, thank you so much for attending. Whatever you're doing over the next few weeks, I hope you have a restful, fun time to recharge and reboot yourselves for 2025. And I look forward to seeing some of you on our webinars in 2025. Thank you very much, everybody.